Hi, everybody. Thank you so much for your kind invitation. My name is Dr. Claudio Conforti from the Dermatology Clinic of Trieste, Italy. And today I'm going to discuss with you the impact of COVID-19 pandemic on dermatology practice worldwide. And I'm going to show you the results of a survey promoted by the International Dermoscopy Society. I don't have disclosures for this presentation, and so we can start. Everybody knows this date, unfortunately, March 11th, 2020. In this date, in fact, COVID-19 was declared a pandemic. And to face this emergency, to cope with this worldwide emergency, hospitals have been rapidly reorganized. For example, departments, including dermatology departments, have been closed or readapted to focus only on urgent healthcare services. Moreover, telemedicine services were rapidly implemented to guarantee the remote management of patients requiring. And so we started to use teledermatology. Teledermatology can be defined as the use of telecommunications technologies to provide medical informations and services, and we can classify teledermatology in two different subtypes: real-time teledermatology and store and forward teledermatology. Real-time teledermatology consists of a live consultation with the patient, and teledermatology using mobile phones is referred to as mobile teledermatology. While differently, store and forward teledermatology, the images of the patients are transmitted to the physician as first step, and after this transmission, the consultant giving a relevant plan of action regarding the diagnosis and also the management. But the question now is, did dermatologists use teledermatology during COVID-19, and how dermatology units changed their activities during the pandemic? For this reason, during the pandemic, I have to thank the past president of the International Dermoscopy Society, Professor Iris Zalaudek, and Professor Emilios Lallas, who shared with me this survey. We send a questionnaire to the IDS members to know how COVID-19 pandemic changed the daily activity of dermatologists. So, regarding the materials and methods, we send an online questionnaire to all IDS members, and this questionnaire consisted of 24 questions: 4 regarding the respondents' personal data, 7 on the organization of the dermatology department or private clinic during the pandemic, and also we asked for possible contact with COVID-19 positive patients. 9 questions were about the cutaneous manifestations in COVID-19 patients, and 4 on teledermatology and diagnosis during the pandemic. The questionnaire was anonymous, of more or less 5 minutes of duration, and was approved by the International Dermoscopy Society Executive Board members. And these are the results. First of all, you can see in the table that we have 678 members who completed the International Dermoscopy Society survey. And regarding the working place, the great majority of responders worked in a private clinic and or in a university hospital. And you can see that we asked also if dermatologists reduced their daily work activity since the beginning of the pandemic, and more than 75% of dermatologists unfortunately did reduce their daily activity. Then we asked if the number of teleconsultations were as usual, or increased, or double, or multiplied during the pandemic. And you can see that more or less more than the 40% of responders answered that the number of teleconsultations multiplied during the COVID-19 pandemic. But one of the worst data that we collected during this survey is that the number of melanomas diagnosed during the COVID-19 pandemic was almost zero, as reported by more or less the 57% of dermatologists. This is an incredible result because we know that we as dermatologists we are trained to do an early diagnosis of skin cancer, while during the COVID-19 pandemic we saw less than half of the usual number of melanomas. So we diagnose melanomas not as always. And the same concept can be applied also for non-melanoma skin cancer. In fact, the great majority, more than 50% of responders answered that the number of non-melanoma skin cancer that they detected during the pandemic was less than half of the usual for 27.11% of respondents, and almost zero for the 37.31% of responders. And then we asked also what kind of skin manifestation the dermatologists did see during the pandemic. And you can see that these are obviously the first data regarding the skin manifestations of COVID-19 virus. You can see that the most frequent cutaneous manifestations were morbilliform skin manifestation, followed by urticarial rash or purpuric manifestations, acrodermatitis, chilblains. We know nowadays that chilblains are strongly associated with pediatric manifestation, cutaneous manifestation of COVID-19. And which consequences of this delay, of this change of our daily activity? The consequences were that we started in the following months to see more advanced tumors. For example, more advanced squamous cell carcinoma, more advanced melanoma, and sometimes, unfortunately, also at the beginning, at the diagnosis, we found also mets in the liver, or in the brain, or in the lungs. And also, we saw advanced cases of basal cell carcinoma. So we changed completely our activity because we are trained to diagnose earlier skin cancer, while we did start to face with advanced tumors. And now, what about now? Now to change this trend of advanced tumors, of advanced squamous cell carcinoma, basal cell carcinoma, and melanoma, we should increase the prevention campaigns to early diagnose skin cancer. We should also implement the role of the teledermatology in the daily activity, because we started to use teledermatology during the COVID-19 pandemic, and we understood that probably teledermatology can be really helpful in our daily activity. For example, to do a triage of the lesions, and the future direction is to find a validate method to perform the teledermatology. So thank you for your attention. I hope to see you soon, and why not in Trieste. Bye.